Hi, my name is Kristen Wheeler. Today I will be doing trach sectioning and then redoing the dressing. So I would come into my patient's room, introduce myself, and then tell them kind of the process of what we were going to be doing today, just walk them through it all. I would also discuss potential, like a communication way, so like if it was too much or they couldn't tolerate the suctioning, to raise their hand. For this video, that's what we'll say we did. And then I would go ahead and get all my stuff ready and then go ahead and start the procedure. So I would do hand hygiene, and I'm gonna go ahead and suction first. So I would open it up away from me and then don on my gloves. So then I would go ahead and start the suction, get everything ready. And get my normal saline open and ready to use. So once I connect this to the suction, my non-dominant hand will no longer be sterile. Before I do that, I want to make sure that my suction is on in between 80 and 120. And then I will go ahead and attach. So just to make sure it's working properly and to make sure I have the tube all cleared out, I will go ahead and get some saline in here and suck it up. Once I've done that, I can go ahead and start my procedure. So I will let my patient know that I am starting now. And for this video, we've already got something draped over him, so we are good to go if anything potentially comes out or anything like that. So I will go ahead and let him know we are starting. And I will put in a couple inches until they start coughing, and then pull it out and twist and do intermittent suction as I come out. When you come out, you're gonna go ahead and clear the tube again and just make sure everything's out. You would do this multiple times depending on how much secretions, how much the patient can tolerate it. So for this video's sake, I'll go ahead and do another pass of it. So just push it in, and then pull out and twist. That will be discomforting to the patient, so definitely make sure you let the patient know before you do that. So I will be done with that, and for the sake of this video, I am not going to switch my gloves. I am going to just get all this out of the way, and in real life I would perform hand hygiene, and then I would re-don on a new pair of sterile gloves when I opened the dressing change kit. So I would open it away from me like normal, and here's where I would don on the new pair of gloves. So at this time, I'm going to remove it so we can clean it. Now, this doesn't, but depending on the protocol of your hospital, it will have potentially hydrogen peroxide in here or something like that to soak it in and to clean with. So I'm gonna go ahead and let that sit, and then I would come back and clean. So just clean that. And then I would go ahead and reinsert it. So at this time, I'm going to switch the dressing. And so I would go ahead and pull this off. And get rid of that. And in here there are some Q-tips. So I would take the Q-tips and thoroughly clean around and make sure I get anything. And since I have the dressing off, I want to definitely make sure I'm assessing for any bleeding, any pus, anything that is abnormal at all. So just want to assess and really thoroughly get there and clean everything off. So then I would go ahead and put on the new dressing here, and you just want to slide it right like the other one was. And you want to try to keep it, the cut in there, as sterile as possible. So don't want to touch the slit, the pre-cut slit. So just put that in there like that. And then for the sake of this video, I will not be changing the thing that holds it on here. I would, but in real life, if it was saturated or anything like that, I would go ahead and change it. At this time, I would document my findings if I found anything, and just document that I did go ahead and change all this, and then I would be done.